Right now, we are facing an unpredictable and highly dynamic situation as a global community. The COVID-19 pandemic is unprecedented in our lifetime and requires an unprecedented response. The experiences learned from the HIV epidemic can be applied to the fight against COVID-19. We have learned that restrictive, stigmatizing, and punitive measures can lead to significant human rights abuses with disproportionate effects on already vulnerable communities. They can often undermine epidemic responses, sending people with symptoms underground and failing to address the underlying barriers that people face in attempting to protect their own health and that of their community. In the face of COVID-19 crisis, we are all vulnerable. The virus has shown that it does not discriminate, but marginalized communities and most vulnerable populations are at heightened risk. As in the AIDS response, governments should work with communities to find local solutions. Key populations must not bear the burden of increased stigma and discrimination. Governments must do all they can to protect the rights and the health of everyone. Protecting the rights and the health of all people will in fact help control the virus. UNAIDS is urging people to act with compassion, not stigma and discrimination. People affected by COVID-19 are part of the solution and must be supported. We need to build a culture of solidarity, trust, and kindness. Our responses must be grounded in the realities of people's lives and focused on providing uninterrupted health services. Engage affected communities from the beginning in all response measures to build confidence, ensure suitability and effectiveness, and to avoid indirect or unintended harms. Combat all forms of stigma and discrimination, including those based on race, social contacts, profession, and those directed towards marginalized groups that prevent them from accessing care. HIV preventive measures such as condom and PrEP should be accessible and available at all times. Ensure access to free or affordable screening and testing and treatment and care for the most vulnerable and hard to reach. Mechanisms for consistent and reliable supply of life-saving antiretroviral drugs should be in place. Remove barriers to people protecting their own health, such as fear of unemployment, healthcare costs, presence of fake news, and lack of sanitation infrastructures. In battling HIV, we are vigilant with everyone's identity. We are told not to judge because we know that viruses do not discriminate in terms of nationality, occupation, sexual orientation, nor social status. Much like HIV, SARS-CoV-2 does not show prejudice as well, but neither does it strip away privilege. Privilege should be used as a helping hand for those who have less and not as a weapon to discriminate. Privilege, if used for kindness, will bring about equity, and only when we are all in the same platform can we rise as one. We rise as one, not by clan, not by religion, not by sexual orientation, and definitely not by social class, but as one people. We rise as one because we are all equal, because we look out for each other, because we are all responsible for one another. When we can rise as one with our kindness and mindfulness of others, only then can we flatten the curve as one strong nation. Thank you and stay safe.